Here with Amy Vaughn, discussing OT and learning about its many benefits. So first of all, Amy, tell me about yourself.
Well, my name is Amy Vaughn, and I am a pediatric occupational therapist. And so that means that I've gone to an undergraduate program in preparation for an occupational therapy degree, and then I've received an occupational therapy degree, and I'm licensed in the state of Missouri. And then after at least 5 years of practice, OTs can kind of specialize. And so I've gone back and I have my board certification in pediatrics. OTs can get their board certification in a variety of things, hands or geriatrics or mental health, those kind of things. And I have mine in pediatrics. So.
Thank you. Can you tell us a little more about what OT is?
Okay, occupational therapy. Sometimes we use the longest, hardest words to describe some of the simplest things, right? Occupational therapy is a therapy that is appropriate for babies, anywhere from birth forward, and elderly people, anywhere before death. So it spans a lifespan as far as its relevance. Now, the types of things that, of course, the therapist would do at different ages are vastly different. So today we're going to kind of focus on pediatrics and what that looks like. A pediatric OT is going to treat any child who is birthed to about 18 years old. And in doing that, we look at a variety of things. But occupation in this sense means, what is a child's job? Child's job is to be able to eat, sleep, get dressed, do some of those self-help things. Then a child's job morphs into being able to play and have play skills and interact with others very successfully. And then, academically, handwriting, being able to perform and tell people what you know. That's a lot of your daily job, right? So OTs would look at all of those things. They're going to look at everything from visual perception skills for how a child takes in visual information and is able to give it back. Handwriting skills, fine motor skills, being able to button buttons and zip zippers, those kind of things. Self-help skills, being able to participate very actively in a bathroom routine, shower, bath, toileting, all of that. A mealtime routine with the family. Can the family go to a restaurant successfully and eat out? What are the elements involved in that, and are they right now strengths for the child, or is that kind of a barrier to the family being able to go live life fully and have really nice family time? So we would look at all of those things. Self-regulation, being able to get excited and calm down, being able to take in information, visually scan information from the environment, find the cues that the teacher is talking about, and then utilize them. All of those things are kind of a part of what an OT would look at too. And then basic things, motor and sensory. OTs will look at balance skills, motor coordination, motor planning types of things. Then they will also look at how that child performs on specific skills, like how to form a letter and how to write their name and some of those things. So,
what kind of things are you doing when you're working with a child in OT?
OT is usually one of the most fun times of the week. We do a lot of play, and if we've done our job really well, it looks a lot like play. And so once in a while, if a parent is watching or participating in a session of OT, I encourage parents to ask that OT, tell me what you're working on. Because though it may just look like play to you, there will always be an underlying neurological or motor sensory purpose behind the activity. And that's what we call therapeutic activity. If we can make an activity look fun, interesting, a child's motivated to participate, then it's therapeutic because they're engaging in that activity at a higher level than they would have when they walked in the door. Does that make sense?
Yes.
And so that's our goal in every therapy session, is to find the just right fit of activity that really makes the kiddo excited and proud and builds confidence, but is meeting them at their just right neurological level for what they've got going on as a strength for them, and then to slowly build in those next skills. whether it's the next skills for self-regulation or the next skills in a motor task or whatever that might be, taking them from the place where they're starting to move forward in development. That's what we do.
Thank you.